Bismillahirrahmanirrahim. Assalamualaikum everyone. I'm Fatima Tariq from BT department. So today in this presentation I'm going to share some of the useful information about the chemical substance pethidine. So let's start. Here is an overview of this presentation. This presentation includes useful information about pethidine by including some of its aspects like chemistry, mechanism of action, pharmacokinetics, therapeutic uses, adverse effects, current research, and conclusion. So let's take a look on each of them step by step. Here comes the first section of chemistry. So in this section, I am going to share that pethidine, also known as methidine and sold under the brand name Demoxil, among others. It is basically a synthetic opioid pain medication of the phenylpethidine class. Phenylpethidine class is the chemical class of drug with a phenyl motility which is directly attached to pethidine. Pethidine is a synthetic opioid analgesic medication that is commonly used for the management of moderate to severe pain. Opioid analgesic medications are those that act on opioid receptors to produce morphine-like effect. Medically, they are primarily used for pain relief. Pethidine is a synthetic opioid that belongs to the phenylpethidine class of drugs. It is basically a white crystalline powder that is soluble in water and ethanol. Its chemical structure is similar to that of morphine but with a pethidine ring instead of morphine ring. Pethidine ring is a heterocyclic amine consists of a 6-member CH2 bridges and 1 amine bridge. Here you can see the chemical structure description of the chemical substance pethidine, its chemical structure and also the chemical bonding between atoms. So we will move forward in the section of chemistry to the chemical reaction, but before let's talk about some of its history. Pethidine was first introduced 23 years ago, still by far the most widely used synthetic potent analgesic drug. We have studied the early work by investigating the fate of pethidine in men during state of mild metabolic acidosis. It is that state in which kidney somehow fail to remove acid from our body and accumulates in the body to a toxic level. And also alkalosis, it is that abnormal pathophysiological condition which is characterized by buildup of excess base or alkali in the body. It results in an abnormal high serum pH level which is greater than 7.45, with urinary pH at the extremes of the psychological range. Similar studies were made on the less active analgesic atoheptazine. It is an opioid analgesic form of the phenylphenidine family. It is basically a ring expanded analog of pethidine, in which the pethidine ring of pethidine is replaced by a 7-member ring. The results are shown to be of both pharmacological and forensic importance. Next, estimation of pethidine and metabolites in urine was by the method of Burns in 1955. This method was satisfactory for the estimation of pethidine and norpethidine. Norpethidine is basically a 4-phenylpethidine derivative that is both a processor and toxic metabolite of pethidine. The chemical processes involved in the conversion of methylphenidinic and non-methylphenidinic acids and their conjugates to the lipid-soluble ester. Pethidine and norpethidine cause some degradation of the molecules and recoveries are somewhat low. Chromatography of dinitrophenyl derivatives of norpethidine and noreptoheptazine was by the method of Astor in 1960 and Astor in 1961. For the direct chromatography of pethidine, atoheptazine and NOR derivatives, a chloroform extraction was made from alkaline urine. The chromatography was in a butanol acetic acid water mixture. An anhydride spray was used for NOR derivatives. The color obtained with the NOR derivatives of the drugs and other urinary heterocyclic amines gives the characteristic dull red fluorescence in ultraviolet light, whereas that obtained with the other urinary amines gives no fluorescence. A platinic iodide spray was used for unchained drugs. So after all the observation and experimentation, the result was that pethidine was metabolized as shown. The drug is either demethylated to norpethidine or the ester linkage is hydrolyzed with the formation of metapethidinic acid. Next, we will move forward to the mechanism of action. Pethidine acts on the micro-opioid receptors in the central nervous system to produce its analgesic effects. Micro-opioid receptors are a class of opioid receptors with high affinity for alpha-phenyl and beta-endorphin, but with a low affinity for dynorphins. Like morphine, pethidine exerts its analgesic effect by acting as anostic at the micro-opioid receptors. It has also some affinity for the delta and kappa opioid receptors. Delta opioids, which are denoted as DOP, is widely distributed in brain without significant difference between rodents and humans. And kappa opioids, which are denoted as KOR, it is bind to dynorphin A and B. They play a role in analgesia and reduction in gastric mortality. Pethidine works by inhibiting the release of neurotransmitters such as P, which are involved in pain perception. Pethidine is often employed in the treatment of post-anesthetic shivering. It is an involuntary oscillatory muscular activity during early recovery after anesthesia. The pharmacological mechanism of this anti-shivering effect is not fully understood, but it may involve the stimulation of K-opioid receptors. Pethidine has structural similarities to atropine and other tropine alkaloids. Atropine is a non-selective muscarinic receptor which is also inhibited and it is used to treat acute sinus node dysfunctions. Also, tropine alkaloids is a special class of alkaloid and can be more specifically defined as all molecules that possesses a tropine ring system. The pethidine has structural similarities to atropine and other tropine alkaloids and may have some of their effects and side effects. In addition to these opioidic and anti-clogenic effects, it has local anesthetic activity related to its interaction with sodium ion channels. Pethidine also affects the activity of noradrenergic and serotoninergic system, which may contribute to its analgesic properties. Noradrenergic system is a neural system that is responsible for synthesis, release, storage of norepinephrine neurotransmitter, while serotoninergic system is a collection of neurons and nuclei distributed along brainstem. Pethidine's appearance in vitro efficacy as an antiplasmodic agent is due to its local anesthetic effect. It does not have antiplasmodic effect in vitro. Pethidine also has stimulant effects mediated by inhibition of the dopamine transporter DAT and norepinephrine transporter NET. Because of its DAT inhibitory action, pethidine will substitute for cocaine in animals trained to discriminate cocaine from saline. Like other opioid drugs, pethidine has the potential to cause physical dependence or addiction. The specially served side effects unique to pethidine among opioids, serotonin syndrome, thrush, delirium, dysphobia, tremors are primarily or entirely due to the action of its metabolite, norepinephrine. Next, we will move to the section pharmacokinetics of the chemical substance pethidine. Pethidine is rapidly absorbed after oral administration with peak plasma concentration reached within 1 to 1.5 hours. Its bioavailability is approximately 50%. Pethidine is metabolized primarily by the liver, with approximately 50% of the drug excreted unchanged in the urine. The elimination of half-life of pethidine is approximately 2 to 4 hours. Pethidine is quickly hydrolyzed in the liver to pethidinic acid and is also demethylated to norepinephrine, which has half the analgesic activity of pethidine but a longer elimination half-life 8 to 12 hours, accumulating with regular administration or in kidney failure. Norpethidine is toxic and has convulsant and hallucinogenic effects. The neurotoxicity of pethidine's metabolites is a unique feature of pethidine compared to other opioids. Pethidine's metabolites are further conjugated with glucuronic acid and excreted into the urine. Here you can see the metabolism of pethidine. This cycle shows pethidines, norpethidines, pethidinic acid, and norpethidinic acids and their section via kidneys.